You know your history of your thyroid. Do you know what it could mean for your future? Well, the advice is to know both of those. It's the advice, this International Thyroid Awareness Week. Well, problems with this little gland in your neck can seriously affect your quality of life. The disorder is often influenced by genetics, and therefore the importance on your family history even more so. And joining us this morning, it's endocrinologist Dr. Sindeep Bhana, making time for me this morning. Dr. Bhana, good morning to you. I appreciate your time. Just for those of us who don't know, and I'm going to admit me as well, where in your neck is a thyroid, and what exactly is this thing supposed to do?
Good morning, and thank you for having me on your show. So the thyroid gland is one of few endocrine organs, and it basically sits here in the neck. It's a butterfly-shaped gland, and it controls the entire body's metabolism. So that's where it's positioned.
So what can go wrong? Why do we need something like International Thyroid Awareness Week? Where can things start going wrong? I do remember I had a family member who had hypothyroidism. I hope I've said that correctly. And that was quite a big issue for him as well.
You've said that perfectly. So basically, the thyroid gland can either be overactive, in which case you have too much thyroid hormone and it can cause palpitations, anxieties, tremors, extreme loss of weight. And then, like you've got a family history, you can have an underactive thyroid. And there are many causes, but the commonest cause is autoimmune. It is genetic, and it's called Hashimoto's. So that's when the gland's not producing enough hormone, and you can have any one of 37 different symptoms. Namely fatigue, malaise, hair loss, dry skin, menstrual issues, fertility issues, bowel problems. So you can see the list is just extensive, and that's obvious because, like I started off by telling you, that the endocrine gland controls the body's metabolism. So obviously it's got its fingers in a lot of different medical conditions.
It sounds to me like it could be just about anything, though. Sorry, forgive me, Dr. Bhana. It sounds like it's got quite a wide range of symptoms. Obviously, we don't want anyone to start panicking if they might, for example, not be sleeping well, or it could be just affecting how they're feeling on a day-to-day basis. How do we know if it's a thyroid issue or if we're just having a bad week?
So, I mean, you hit it on the nail. You know, there are so many symptoms linked to an underactive thyroid, and there's no need to be panicking. This is not an interview to create alarm in society. One needs to understand that there isn't anything specific in those symptoms that can suggest that you may have an underactive thyroid. There's one where women will lose the outer third of their eyebrows, and then that's more likely to be an underactive thyroid than any of the other causes. But most of the other symptoms are non-specific. So that's where this family history becomes very important, because autoimmune conditions generally do have a family history, and this condition mainly affects females. It doesn't mean it doesn't exist in males. And so my study has shown that in South Africa, about on average 4.5% of adults will have an underactive thyroid, and around 1% will have an overactive thyroid. But this prevalence varies from race group to race group. And so certain race groups are more prone to autoimmune condition. And so that's why it's important to know your family history. So let's say if your mom had an underactive thyroid, or your granny had an underactive thyroid, then the females in that family have a 40 to 60% chance of developing an underactive thyroid, this Hashimoto's, and it can happen anytime. So it doesn't necessarily have to happen at the age of 8 or 16 or 24. And so one needs to be vigilant, especially if there's a family history.
Is there anything that can be done, for example, if you were, as you explained, Doctor, you do have a family history from this, and you know your family history? I'm going to ask you what we do in a moment if we don't know our family history, but let's say we do. We'll use your example as well. Is there anything that someone can do to prevent this from happening as they get older, or if it's genetic, sorry, hang on for you, strap in, it's going to get bumpy?
That's a very good question. So obviously, the world is moving towards prevention, and your question pertains to that, to say, if I've got symptoms, if I've got a family history, one needs to screen for an underactive thyroid or an overactive thyroid. Yeah, your general practitioner, your local clinic, your government hospitals can all run a simple blood test called a thyroid function test. And they may run a test for antibodies. That's measuring the army of cells that are actually attacking the thyroid gland. But yeah, a simple thyroid function test will tell you whether you've got an overactive thyroid, underactive thyroid, or a normal thyroid. And then if, of course, it's underactive, the doctors can definitely treat it. And that treatment is available in every state hospital, and it's readily available in private practice as well, and it's an inexpensive drug for to manage an underactive thyroid.
Let me ask you this, just in closing, Doctor. What happens if you don't treat a condition like this, either an overactive or an underactive thyroid? Is this a death sentence?
So with an overactive thyroid, in some cases, it can be a death sentence, because if it's missed, you can end up having something which is very rare called a thyroid storm. But an overactive thyroid, if it's missed, can affect the heart and lead to cardiac failure. It can cause osteoporosis and can land you in ICU. An underactive thyroid, very rarely, if the entire thyroid gland is not working, one can go into what we call a myxedematous coma. But by and large, it's not going to land you to death, but it will cause a lot of symptoms, like we said. And again, it can affect the heart, it can affect fertility, it can affect your cholesterol, your blood pressure. And so, because it's a condition that can easily be managed, and there's an autoimmune theme to it in most cases, there's no reason why we should have many undiagnosed people walking around in South Africa with an underactive thyroid. And the means are there.
I really will leave this as my last question. Something just came to me now. You mentioned a grandmother or a mother, especially on the female side, Doctor. Is there a particular age where somebody watching should start keeping an eye out for this? Is this from once you've come through puberty into your adulthood? Could it be younger than that as well? And how big is the problem in our country, just as I say goodbye to you?
Yeah. And so, look, the underactive thyroid can occur at any age. One can be born with it, but by and large, that won't be missed at the clinics or in the hospitals, and it can happen at any age. So around puberty, around pregnancy, just after pregnancy, around the perimenopausal state, those are periods where there can be massive fluctuations in the thyroid hormone. And so those would be the high-risk areas in a female's life. Of course, if a female is having difficulty falling pregnant, that should alert the obstetrician to do some tests as well. And then how prevalent it is, I started off by saying about 4.5% of adults, so that's about 2 million people in South Africa possibly having an underactive thyroid, and we're looking at close on to about 200,000 people with an overactive thyroid condition.
And as you say, it's so easily treatable as well. As you quite rightly say, Doctor, it's about the prevention, not the treatment. I think that's what the theme of this week is also trying to get across. Know your history, understand your future. Thyroid Awareness Week. Doctor, it's been a pleasure. Thank you very much indeed. Endocrinologist Dr. Sindeep Bhana. Such an easy test to go for. If you do have a family history of that, it is highly, highly recommended to just go for that simple test, especially if you know you do have it in your family.